gonna see. Hi, people. I can't really catch up. I think I might do it this way because I'm using a brand new system to me, and I want to be able to see what is going on in both places. So I see that there is a delay. Can somebody just support me? If you see me, can you drop a message in the chat so that I can see what the chat looks like? If I can see the chat comments, so I can see what the chat looks like. Can't post comments to Instagram. Okay, well, we just gonna have to make it do what it do. I can see people on both sides, so I have Instagram on one side and I have StreamYard on the other. This is all new to me. Those of you who follow me know that I typically do not go live. However, I'm trying new things this year, brand new things, and so thank you all for joining. And I want to honor your time, but please feel free to ask me questions. I will be answering questions if you have them. Oh, hey, Brooklyn King. Hey, I see Treya. I see Aisha, Dr. Joanne. Okay, so I'm seeing people. I can see comments. Okay, great. So if you see me going back and forth, y'all know this is new to me. Doing this, but this year I want to be very intentional about making myself visible and offering support to people in the ways that I can. So I'm here. I'm here. What up, y'all? For those of you who do not know me, my name is Melissa Eiffel, and I'm a licensed clinical social worker and a sacred transformation wellness coach with over 25 years experience working with many different populations. But right now, I specialize in working with Black women to support them in their healing. And we're going to talk a little bit tonight about what is healing, because there's so much that we've heard, especially over the past few years, about healing and people being on their healing journey. And as I sort of acclimate you guys to me, I want to be clear that I'm talking about this from my own perspective, from based on the work that I do. You will hear information from a lot of people. I'm sure you have heard information from a lot of people, but I'm offering this information to you, to those that this resonates with, so that you can hear it from, maybe it's a new voice, maybe it's an old perspective, but I want to add my voice to the mix, okay? So let's begin with this question about what is healing? What is healing? And I want to be very clear that healing is a misnomer. Healing is a misnomer, right? Well, actually, healing is not a misnomer. Healing indicates that it's an active process. When people say that they can't wait to be healed, that's a misnomer, right? There is no such thing as healed. Why? Because healing is the process of recovering from the impact of painful experiences that have happened in your life, right? So it's recovering from the impact of painful experiences in your life. And so, what does that mean? We all have things that have occurred in our life that have shifted us in some way. Some things may have shifted us more than others. But a lot of times, what occurs is we feel the impact of those things, oftentimes in our most vulnerable states. And then, because we're vulnerable, oftentimes many of us were younger, we don't even consider the way that those things changed us across the span of time, and the ways that we've developed into being across the span of time, right? So it may have shifted your perspective on the world, the way that you trust people, and it may have even shifted how you view the world and how you show up in the world. And so healing is the process of uncovering what has happened to you, the way that it has impacted your spirit, and what we often don't talk about, the way that it has impacted your body. Now, why is the way that it has impacted your body important? Because the impact of our lived experiences impact our DNA. And so oftentimes when we find ourselves on this journey, we're not just healing from what has occurred right now or the things that are lived experiences. We're also healing from things that are intergenerational or ancestral experiences. So when an event happens, it changes how you view the world because it has shifted the cells in your body. And so when we're going on the journey of healing, what we're going on is the journey of not just reducing the impact, but a lot of times it's uncovering what has happened in our lives and also what has happened throughout the span from our ancestors that have shifted the way that our body responds to situations today. So I think that that's really important for us to understand. Okay. Now, over the past few years, we've heard a lot of things about trauma, and really the big question that I get all the time is, what is trauma? And I really want to normalize this for you, is because trauma is anything that has negatively impacted you. Anything that is a painful experience that has negatively impacted you can be considered a traumatic experience. Now, that might be a little bit controversial because you're going to hear some people say, well, you don't meet the criteria for diagnosis, excuse me, or this really isn't traumatic. It's just something that is hurtful. But I want you to consider if you were to scrape your arm somewhere, right? Now, that cut might be a deep cut, or that cut might be a surface wound. But because it is a wound, it is something that is different, that is new to the skin that was not there before. It is considered to be a trauma. Now, you might not need to go to the burn unit. You may not even need to go to the hospital. You may not even need to be seen within urgent care, but you will need to give it some attention so that you are able to address the change that has occurred to the skin as a result of the hurt. And that's really important for me to highlight for you, because a lot of times what happens is we have experiences that we are trying to recover from, and we tell ourselves that those experiences are not important enough because they didn't hurt us bad enough. And so we force ourselves to consistently move on from these experiences. And then when we do that, we suppress the feelings that we have, which oftentimes exacerbates the issue. So tending to pain points, tending to experiences that we have really supports us in being able to care for ourselves. And what studies show is that when you're able to care for yourself in that way, it actually reduces the negative impact that the experience will have on you for an extended period of time. So if we go back to the wound on the arm, right? If you have a cut and you don't tend to it, but you're walking around, you're doing things every day, and it gets exposed, that cut can then get infected. And what may be a superficial wound or something that didn't require deep attention is now something that requires a lot of attention because it has an infection. And so that's what happens to us a lot, right? We have been trained, many of us, that the things that occur in our lives don't matter. They're not important. Our feelings about them don't matter. And so we need to suppress them. And so we often find ourselves in this big old age that we are, no matter how old you are, finding ourselves in places that we're recognizing that something isn't right, something is happening that we need to shift from. And so then we find ourselves going on this journey of, what we have been labeling as healing. Okay? So that's healing and that's trauma. All right? So how do I begin my healing journey? I think this is important question that I get oftentimes because people don't know if they should start or not, right? You have a lived experience, you have something going on, and you might just be thinking that I'm okay. I've lived all this time dealing with these things. I know these things happen. Sometimes people are having brand new memories over the past few years because there's been so much conversation about trauma. People are just now understanding the impact of their lived experiences and then recognizing what the pain points are. And you still might be thinking, well, like, do I really need to go on a healing journey? Do I really need to even shift? I've lived this far. I've done this well. Life is so good to me. And what I will tell you is, yeah, you do. Now, we're going to talk a little bit about what you need to do or what some of your options are. But the reason why I say, yes, you need to allow yourself to go on this journey of healing is because ultimately healing, at least the way I do it, is the journey of understanding yourself better. It's the journey of figuring out what it is that has happened, the impact that it has had on me, and the behaviors that I've engaged in, and the patterns that I consistently engage in. When you're not doing the job of getting to know yourself in a deep way, the experiences that you're having, the behaviors that you're engaging can be choosing you because it is a response to your pain points. And so you're not actually choosing the life that you want. You're not actually making decisions that are aligned for you or that feel best for you. You're not actually looking around and seeing if this is the life that you want or if the people in your life are the people that you want in your life. You are moving through life on autopilot. And when you move through life on autopilot, you have what I like to call friction points, right? Friction points meaning these moments of tension in your life where life does not feel good enough, where you may not even feel good enough. You may feel sadness unexplained, anxiety unexplained. You may feel conflict within yourself or with others unexplained. And a lot of times I find that when I do the deep work with my clients, we are able to uncover the information that the body holds about the pain that they have experienced, the things that have occurred in their life that they think do not matter. And so going on this journey of at least figuring out what has happened and the impact that it has had on you allows you to dissect, is this what I want? Are the patterns that I consistently engage in the patterns and behaviors that I want to consistently engage in? Or do I want to do something different? Do I want to make different choices? And in that way, you get to choose your life. My clients know, my people who've been following me know that is one of my taglines. You get to choose. You get to choose your life as opposed to your life simply choosing you, or rather, the circumstances from your life creating a version of you that you think you need to be, and you're actually not happy with it. Now, it's important for you to be in a reflective state, to really understand who you are and to really understand the challenges of things happening in your life and then also happening in your body, right? So many of us feel anxiety. So many of us have illnesses happening in our body and we don't even have a clue where they stem from. We think that it's just the way that our body works. But a lot of times, once again, when I sit down with the people that I work with and we do the work, when we start to sort of peel back all of the layers, a lot of the health conditions that they're experiencing, we see the symptoms subside over time because it is the body's way of communicating to you that there's something that you've lived through, something that you continue to experience within your body that is creating illness in your body. And so it becomes very important for you to do healing because you're getting to know yourself. You're getting to know yourself inside and out. How do you begin? You begin by being mindful about who you currently are and understanding what those friction points or opportunities are for change or choosing, right? So, what am I doing that I don't want to be doing? What's happening in my life that doesn't feel good to me anymore? And it's important that this work starts with you because you are likely seeing reflections in your life show up all the time. Those reflections can be from people in your life where you find that you're in consistent conflict. Maybe you have some resentment towards them. Maybe there are people in your life reflecting to you how you're showing up. They're communicating to you that the way that you function in the world impacts others in a way that is hurtful, or you simply feel at a discomfort in your body often. And so it's important for you to begin from an introspective place, because what I find is that some people start this journey. They may see a therapist, they may go to see a coach, they may start reading a book, and everything is about projection. Well, I'm here because they did. I'm here because they said. I'm here because I believe that like other people. And so there's this meme that I've seen is that like many of us go to therapy because we're trying to deal with the other people who refuse to go to therapy. And a little bit of that is true, but we go to therapy because the people in our lives and the experiences that we've had have impacted us. And guess what? Oftentimes you're choosing those people in your life. Oftentimes you have a pattern of engaging with those people in your life if you didn't choose them, right? Like if they're family that you cannot break out of. And so it's not just about other people, it's always going to come back to you. And so it's important that you begin, right? You begin this work with considering who you are and how you show up, and if there's anything that you truly want to do about it, right? If you truly want to do about it. Now, different types of healing. Actually, let me go back a little bit, right? When we're talking about beginning, right? So we begin with the introspection. Then after the introspection, it is going to be important for us to be open to change, right? That's the second point. The third point is that we really need to be open to seeking support. Now, support can show up in many different ways. It can show up in the form, for a lot of people in the beginning, it's the form of uh, self-help, right? So it could be meditation, it could be journaling, it could be yoga, it could be self-help books, it can be sound healing. Those are different modalities depending on how you're engaging in them that, I would label self-help. Those are awesome ways to begin because they support you in being a little bit more introspective and then drawing some lines. You don't have to begin there, right? Like if you know that you need support, you can jump right to seeking a helper. But I find that many people kind of inch into the process in the lane of self-help, and I will tell you that there's absolutely nothing wrong with that. And then the other thing, the piece about beginning, is seeking helpers. Seeking helpers is very, very, very important. And so let's talk a little bit about the different types of helpers that are out there. And so I'm a therapist, right? Like I'm licensed, right? I've been doing this for 25 years. I have been licensed for, what's this? I've been licensed for, Jesus, 20 years, right? So it's been a long time that I've been doing this work. And I want to say that, at the risk of having some of my colleagues be upset with me, I want to say my first point of healing, of like really truly deep healing, really truly being able to reflect and to see myself, did not come in the form of a therapist. It did not come from my therapist, right? I had actually been engaged in therapy for the first time when I was in college, and I was realizing that I was dealing with the grief as a result of the loss of my mother. And well, actually, when I was in college, she had not passed away right yet, but I was dealing with the transitional issues of like coming out of college, a lot of depression. I had, managed depression for most of my young adult life, most of my life. And I had went to a therapist, and it was cool, but I went for like 2 sessions, and it really didn't do much for me. Like she helped me think about some things, but she really didn't help me manage symptoms. And quite frankly, I felt like there was no connection. I was a young Black woman from an urban environment. I was talking to a white woman who was from, or at least living in a, very, maybe not rural, but upstate New York. So I'm Caribbean. We didn't have much in common. I didn't think that she understood me. So we spoke, and we spoke for a few sessions. It was okay. It was supportive, but it really didn't do healing work for me. The second time was when I was graduating with my master's degree. And by that time, my mother had passed away. And I realized that the convergence of grief as well as the transition was difficult for me. And I went back to, campus counseling because it was what I knew. And the same thing, went for a few sessions, helped to reduce a little bit of the symptoms, right? Or the, pain I was feeling, but it didn't really introduce me into true healing. And I think that's important to know because there are different types of ways to do the work, and there are different ways that people choose to do the work. And I think that that's important, right? Because some people just don't want to feel bad. Some people just don't want to feel bad. And that's okay, right? And there are people who will work with you to support you in what in the profession we like to call symptom amelioration. The focus of it is simply to reduce the symptoms, simply to reduce maybe the frequency and the intensity of the anxious symptoms, or the depth of the depression, or the constant negative thinking, and that is okay. But for me, when I think about the work that I needed and the work that I'm passionate about engaging in, that is just the first tier. Symptom amelioration is simply the first tier of the work for me. Some helpers start and stop there, and that's the only work that they want to do. What I needed and the type of work that I'm passionate about is actually changing your life, right? I needed to change my life. I needed to change the way that I saw the world, because between that second time that I went to a therapist when I was graduating with my master's, and so like, well, I don't know, like between that second time and my suicidal ideation, like a deep period where I was suicidal, I had multiple periods of that within 2 years, right? And so what I know now that I've been deep in doing this work and receiving this work, my view of the world and what was happening in my body needed to shift, and talk therapy was not going to do that for me. So I actually found my first deep healing experience through spiritual work, right? I needed someone who was intuitive. I needed somebody who I could not BS. I needed somebody who could be straight up and down honest with me. I needed someone who had some wisdom, right? In addition to her intuitive abilities, to walk me through this process, and who was committed to walking me through this process, right? I needed that level of commitment. And so I just want to be transparent when we're talking about helpers. Even as a therapist, I do not recommend everybody seek therapy, because while I think therapy can be helpful for everyone, not everyone is seeking or looking for that level of work, right? So I just want to be transparent about that. I just want to be completely honest about that. The other piece about this piece about, like, when we're looking for a helper, we have to understand who we are, and then therefore we also have to understand what it is that we need, right? So like I said, I, as someone who's a trauma survivor, who has ancestral and lived experiences, this thing about being a perfectionist, being a, overperformer, showed up even when I was in therapy. And so what did that mean? That means that I told her things, but I never told her the depth of it. I only told her a piece of it. And this is kind of skipping down to what's your responsibility when you begin the journey. But I told her just enough to where she wouldn't think too bad about me. And that's okay in the beginning, because as you develop therapeutic rapport, right, sometimes that will shift. Sometimes you will give yourself permission to stretch. But the reality of it is that when we feel a gap between who our helper is and who we are, we don't always let them in deep enough, right? We give them just enough to help us just enough because we have our own defense mechanisms going on. And so it's important that you understand who you are and the stage that you're in, because as you're going on this journey, what I find sometimes is clients come in and they are not prepared to be open. They are not prepared to be honest. And they feel as though the helper is the person doing something wrong because they are not receiving full benefit. Right? There may also be a gap between the type of help that they're engaged in, right? The individual is engaged in, and the person who they've sought out for help. Once again, there are different levels, different stages, different depths. And so there's sometimes blame because you need something and you've linked up with somebody who cannot give you exactly what you need. So being open to change, being open to shifts, right? Understanding who you are, being self-reflective is important because then you can also understand where the gaps are, and maybe you can give yourself permission to be honest with the helper about where you are, what you're receiving, and then also how they're showing up to support you, or then maybe to not fully support you. I have had situations with clients where they have felt like we were no longer a fit. Maybe we were a fit at a certain point, but they needed more than what I could offer at another point. And I welcome that because I never want to be working with someone who feels like they're not receiving what they need from me. And so honesty is absolutely necessary. Skip the step in the, conversation, but I felt like it was important to address that there because that's going to impact, right, how you show up, what you need. Your knowledge of self is going to impact who you seek out for help, and also your willingness to go on the journey, right? The journey of healing begins with the journey of finding a helper. Now, the first person that you seek out is not always going to be the best fit for you. So I really do want to encourage you. I know it's hard to divulge yourself and then be like, nah, it's not you. But I do want to encourage that if you're beginning, that you kind of let yourself go on this pathway of seeing who's the right fit, right? And maybe I'll talk about how to do that another time. Maybe I'll talk about exactly what trauma is and the different ways to view trauma another time. But this is just kind of like a beginning, okay? So different types of help. If we go back to the analogy of the cut on the arm that I gave a little bit earlier, right? So we have a cut, maybe it's a light little cut on the arm, and we can tend to it on our own self-help, right? We can tend to it, right? So that might look like, if you want to engage in meditation, if you want to engage in yoga, journaling, sound healing, talking to a friend, you know what your supports are. Maybe you can address some of the impact of the experiences that you're having on your own. I will suggest to you, though, that if you've never been working with a helper that has guided you through your own process of discovering what your own patterns are, as well as giving you toolkits for your toolbox, beginning the work on your own, you don't even know if you have a cut that's infected. You don't even know if you have a deep gash sometimes because you haven't seen the white meat yet, right? So once again, I do recommend we can always have conversations with helpers to get their perspective as to what is going on with us, and beginning, right? Like we can begin on our own, right? So there's coaching, which comes at, different levels, expertise, skill set. There's spiritual work. There is energetic work that can also fall under the lens of coaching or, spiritual work. There is traditional talk therapy. There are somatic therapies, meaning embodied therapies, and there are different types of medicines, right? So we have herbal and we have more Western, what we call psychopharmacological therapies, right? The reason why I listed them all out, because they are absolutely in, no particular order or hierarchy, is because many of these things interlace, right? What I want to tell you is that there are people, and I know there have been some people who have been engaged in coaching and they didn't get what they need. And there have been some people who have been engaged in therapy and they also didn't get what they need. Beyond the specific label of a thing, here are the things that I want you to know. Your mind, body, and spirit is one. They cannot be broken apart, right? So, and this is me. I might have some colleagues who look at this video, I do expect to upload this to YouTube, and I might get some comments where people are like, whatever. Or I might get some comments when I save this to Instagram and folks are like, whatever. But I think it's important to understand that talk therapy is not going to get trauma out of your body. It's impossible, because the way that trauma impacts us, it impacts us on a cellular level. Now, you may have experiences that like you can heal from and shift from, but intergenerational trauma and really deep traumatic experiences that you have to do the work of uncovering, especially when you have patterns of anxiety, depression, conflict in relationships, self-doubt, right? Or you're simply looking to transition your life. Those things talk therapy is going to help you uncover, but it is not going to support you in the real true healing from. You need a somatic embodied experience, and you need an experience that encompasses the mind, body, and spirit. And I really do want to say, from an African-centered perspective, right? Because, my work is with Black people all day, specifically Black women. From an African-centered perspective, we are people of spirit. And so we try to fit ourselves into these Western dynamics all of the time. And then we wonder why they come up short. The reality is because they weren't meant for us. And a lot of the somatic and embodied experiences that are now evidence-based and that now have a footing where we see, insurance is paying for them, hospitals hiring people to do them inside, like Reiki or sound healing, right? These practices are indigenous practices that have centuries and centuries of data behind them, but because they're not documented in a Western perspective, sometimes they go overlooked. So what I'm going to tell you is the best modalities for your healing, for shifting what has happened in your body, will always be an embodied practice. What does that mean? A practice that encourages you, right? A wellness modality that encourages you to feel what it is that is happening around you and the impact that it has on your body, to understand the thoughts that you're having and the feelings that show up in your body as a result of those thoughts, to understand the interactions that you have with people and the shifts that occur in your body and then in your behavior as a result of those experiences. And then, in addition to being mindful of those things, teaches you how to calm the body and to get into a state of awareness and observation of those experiences in the body being in a state of calm so that you can learn how to move through it. When we talk about spiritual practices, we are talking about practices that support us in the interaction with the divine. So we have somatic and embodied practices that support us in tuning inward, right, to ourselves and to understanding the messages of our bodies. And I'm one who will tell you that is my work. I teach you how to connect to your body because your body has all the answers. Point blank. You can't hear them because you've learned to tune them out and to suppress them in favor of other people's opinions and these thoughts in your brain, right? That's a whole nother story. But when we're talking about spiritual practices, we're talking about practices that support us in connecting with divine energy and understanding how that divine energy shows up in us. And so when we're talking about mind, body, spirit, right? And when we're talking about holistic wellness, we're talking about every single thing from what you eat, how you show up in the world, the way that you dress, who you choose to have in your life, going to the doctor, having a medical assessment. We're talking about full scope wellness. And the thing about that that is so important when we talk about full scope wellness is because it allows you to change how you show up in the world, to change how you engage with the world, so that as your feelings show up, because they will, as hurt shows up, because it will, you now have tangible tools and skills to be able to support you in moving forward in life in a way where you're changing on a cellular level. And that really is what healing is. It's the ability to change on a cellular level who you are. It's not just coping with the pain. That is one level, right? That is one level. But when we're committed to shifting our worlds, that is true, deep healing. And shifting ourselves, that is true, deep healing. And so it's important for us to understand that when we're choosing helpers, you understand what stage you're at. Are you just beginning so that you're looking for some self-help support, or like someone just to give you enough so that you don't have to feel the pain, and that's the only level that you're prepared for right now? Are you looking for some spiritual work because maybe you've done like a little bit of work, excuse me, where you've been able to support yourself, or you've learned how to cope with the symptoms, so that now you want to be able to move into the mind body connection? You want to move into your divine connection, right? You want to understand ancestral work. If you are in a Christian practice or an Islamic practice, you want to be able to dive deeper into that and to see how that integrates with you, right? So then you will be looking for a helper who has experience with that. You'll be looking for a helper who knows how to support you in the development of that full scope, right? It's not going to be the same as a therapist who is simply, or a coach who is simply looking at symptom amelioration, right? If you're looking for symptom amelioration, you're not going to be going to someone whose primary work is divine connection only, right? Now, divine connection can be a beginning, but that is not all that they do. They have to have a different way of approaching the world. In some indigenous practices, you can seek the support of a, spiritual wellness person, a shaman, because there are certain medicines that they also have to offer you that will support you in your wellness, but they also may not be able to support you in your thinking. That's the mind, right? That's the mind part, right? If you're looking to get physically well, maybe you want to see a functional medicine doctor, or you want to go see Dr. Joanne, who I saw on the Instagram live a little bit, who is a wonderful psychiatric nurse practitioner who will talk to you about the food you eat and the vitamins and all that good stuff, right? So you want to understand what is the level of healing that you're seeking in this moment in time. And you want to give yourself permission to be where you're at with it, right? Not force yourself to stay in a certain box because you've chosen someone and you like them, or to force yourself outside of a certain box because that's what you were told your insurance will cover only. We have to be committed to understanding ourselves and to going on the journey of being able to identify what we need so that we can be in the mix, right? We can be in the mix and like on the pathway for what aligns for our truest version of ourselves, the truest version of ourselves, not who our pain taught us to be, right? And so I think I've, covered all the points, but I think it's, simply important for us to understand where, what we're committed to, right? When we're on this journey, who we're committed to being and where we are on this journey. I want to talk a little bit before I close out just about this tension between coaching and therapists right now. And as a therapist who is also a coach, I feel the tension, and oftentimes it's why I kind of don't talk about the coaching work that I do. You'll see me talk a lot more about that this year because that really is my passion. And that's where I've seen a lot of the transformation happen in real time and even quicker than in the therapy work that I've done. And the reason why it's important to talk about this tension is because a lot of people are finding, I'm just going to say it. Listen, since COVID, wellness has become a big moneymaker, a big moneymaker. And the reality is, right now, we are in an economy where a lot of people are finding that the economies or the businesses that they chose before are not doing as well as they were. People are not buying things that they don't find that they need. And so over the course of the past 2 years specifically, I've seen a lot of people enter the wellness space, right? Go to school, get a coaching certification or not, and have never done any self-work, have never done any deep self-work, and they're calling themselves coaches, right? Some people have even ventured off into different lands and, rename themselves, right? And they want to come back and they want to be your shaman. And so I want to encourage you, because this is not from a place of judgment, it's from a place of care. Understand that it's okay for you to ask people questions about how they approach this work, where they get their information, what is their training, and how far they can actually support you, right? If you're someone that has suicidal thoughts sometimes, because that's real, many of us do, and we don't name it, and you're talking to someone and you haven't let them know when you're doing your consultation that you have those thoughts. But you're only relying on them. You don't have a team of people working with you. And some people will choose to have a team because maybe you need a coach, maybe you need a therapist, maybe you need a Reiki healer, maybe you need a sound healer, right? So people have teams, and I do advocate for that. And many of my clients know I'm gonna send you, okay, go here and do that, go here and do that, go here and do that. Tell me what it feels like. Let's meditate in session. Let's journal in session, right? We practice these things together. But if you're solely relying on one person and you haven't divulged your whole self to them, but you are expecting them to help you in a deep way, you're doing yourself a disservice. You do not know if they can actually help you. And some people are not honest about if they can actually help you. So don't hesitate to ask how. What is your method? Right? What is your success? Have you worked with someone like me before? Do you enjoy this work? How long have you been doing this work? What brought you to this work? Right? And depending on how open they are, you can even ask, do you have any personal experience? And personal experience is not an indicator of a person's expertise, but depending on what you need, that may also be helpful to you, right? I know I appreciate with the person that I'm working with now, she happens to be a trained therapist, but we're working together in a coaching capacity, and we are very transparent with each other. And I know that a certain amount of disclosure supports me, even as a therapist, supports me in the work that I'm doing with her because it helps me understand things deeper, right? You also want to know what is their level of commitment to you if you're in a crisis, right? Some helpers have firm boundaries around 9 to 5 office hours. You can't text, you have to leave a voice message. Nothing wrong with those boundaries. Others of us, because of how we view the work, and I happen to be one of these people, I'm in constant communication with my clients. Now, I have boundaries around my time. They know that, like, you can text me and I may not respond to you right away. But a huge part of what I do is I help you in real time. Do you need that type of support? Do you need that type of support? Would that type of support help you? Right? Do you need weekly sessions? Do you need bi-monthly sessions? I tend to see people most of the time twice a month, right? Then we move to monthly. Sometimes then we move to quarterly after a period of time, right? So being prepared to go on this journey and to do the work and to include your knowing of yourself in the work and to grow your knowing of yourself in the process of the work will really help you as you go on the healing journey. Right. So I know I said a lot. I didn't necessarily follow my own outline. And damn, we're at 45 minutes. So thank you everyone for joining. Thank you so much for watching this video. This is my first official video that I'm putting on YouTube. If you're looking to work with me, you can please schedule a consultation at melissaifill.com. I'll be talking a little bit more about my work. And please leave me a comment and hope to see you soon.